You wake up in the morning, swing your legs off the bed, and the moment your feet hit the floor, that familiar ache kicks in right behind your kneecap. Maybe it's a dull throb. Maybe it's a sharp stab when you go up the stairs. Maybe it's that grinding, crunching sound that makes everyone in the room turn their heads. If any of that sounds like you are not alone. Knee pain is one of the most common complaints I see in my practice, and here's the thing that shocks most of my patients. The knee itself is usually not even the problem. Stay with me, because today I'm going to show you exactly why your knees hurt, what's actually causing it, and a simple 2-minute routine that can start giving you relief as early as tonight. I'm Dr. Clarence Martin, and this might be the most important video you watch this year. Before we dive in, let me tell you who this video is for. If you are someone who wakes up with stiff, achy knees in the morning, has pain after sitting for long periods, what we call theater sign, feels discomfort going up or down stairs, has been told you have bad knees or early arthritis, or you just feel that constant nagging pain that never fully goes away, then this video was made specifically for you. Now, I want to be clear. This video is educational. It is not a substitute for seeing your own doctor. If you have severe pain, swelling, or a recent knee injury, please see a medical professional. But for the vast majority of people dealing with chronic knee discomfort, what I'm about to share with you is going to be eye-opening. Let's start with the most important question. Why do knees hurt in the first place? Anatomy of the knee made simple. Don't worry, I'm not going to give you a medical school lecture, but you need to understand just enough anatomy to understand why things go wrong. Once you understand it, the solution will make total sense. The knee is essentially the meeting point of 3 bones. You have the femur, your thigh bone, the tibia, your shin bone, and the patella, your kneecap, right here in front. Holding all of this together, you have 4 major ligaments, the ACL, PCL, MCL, and LCL. Inside the knee are 2 C-shaped pieces of cartilage called the meniscus, one on the inside, one on the outside. These act like shock absorbers, and covering the ends of your bones, you have articular cartilage, a smooth surface that allows bones to glide without friction. Here's where it gets interesting. The knee doesn't move in isolation. It's controlled by the muscles above it, your quadriceps and hip muscles, and below it, your calf muscles. It's essentially a slave joint. It goes where the muscles tell it to go, and when those muscles are weak, tight, or imbalanced, the knee pays the price. That's the key insight most people miss entirely. The real reasons your knees hurt. Alright, let's talk about the most common reasons knees hurt. 5 categories. Pay attention because you're probably going to recognize yourself in at least one of these. Weak quadriceps. The quadriceps, the 4 muscles on the front of your thigh, are the primary movers of your knee. They absorb impact every time your foot hits the ground. When they're weak, that impact goes straight into the joint. A study in arthritis and rheumatology found that quadriceps weakness is one of the strongest predictors of knee osteoarthritis progression. Most people with knee pain have measurably weaker quads on the painful side. Weakness creates pain, and pain creates more weakness. A vicious cycle. Tight hip flexors and weak posterior chain. When your hip flexors are chronically tight from sitting all day, they pull your pelvis forward. This changes your entire body alignment. Your femur rotates inward. Your kneecap now tracks in the wrong groove. Every step creates abnormal friction under the kneecap. This condition is called patellofemoral pain syndrome, PFPS, and it has almost nothing to do with the knee itself. Tight IT band. Running down the outside of your thigh is a thick band of connective tissue called the iliotibial band, IT band. When it's tight, which it is in almost every person who sits more than 6 hours a day, it pulls on the outside of the knee and creates lateral knee pain. If you have pain on the outer side of your knee, the IT band is a prime suspect. Poor ankle mobility. Almost never talked about. Your ankle and knee are in a chain. If your ankle can't flex forward properly, from stiff shoes, years of sitting, or old ankle sprains, your knee compensates. It bends inward. It absorbs forces it wasn't designed to handle. I test ankle mobility on every single patient with knee pain, and it's a contributing factor in well over half of cases. Inflammation and joint degeneration. Inflammation is a symptom, not a cause. Yes, your knee may be inflamed, but why? Usually because of one of the 4 mechanical causes above. Osteoarthritis affects millions, and while we can't reverse cartilage loss, research shows very clearly that exercise, strength training, and improved biomechanics can dramatically reduce pain, even in people with confirmed arthritis on MRI. The bone-on-bone diagnosis is not a death sentence. Common conditions explained. Let me quickly go through the most common diagnoses you may have been given and what they actually mean. Condition: patellofemoral pain syndrome. Symptoms and notes: pain around or behind the kneecap, worse with stairs, squatting, or after sitting. Almost always a hip and alignment problem, not a knee problem. Condition: patellar tendinitis. Pain just below the kneecap where the patellar tendon attaches, caused by repetitive stress from jumping or running with weak quads. IT band syndrome, outer knee pain, common in runners and cyclists. Tight IT band rubbing over the lateral femoral condyle. Meniscus issues, pain on the inner or outer joint line. Can be acute tear from injury or degenerative wear. Mild degenerative tears often respond very well to physical therapy. Osteoarthritis, morning stiffness, aching, grinding, most common over age 50, managed, not cured, but very effectively with movement and progressive strength training. Bursitis, warm, puffy swelling around the knee, caused by repetitive kneeling or direct impact. Inflammation of the small fluid-filled bursae sacs. The bottom line? For most of these conditions, movement is medicine, not rest, not just pain pills, targeted, correct movement. And that brings me to the section you've been waiting for. All right, here it is, the 2-minute routine. I call this a 2-minute fix because that's the time it takes, not because knee problems disappear in 2 minutes. Think of this as a daily reset, a way to release tension, activate the right muscles, and take pressure off the joint. Do this every morning before you get out of bed, and again before bed. Within 1 to 2 weeks, many people notice a significant difference. Here are the 4 moves. Each one is 30 seconds. Supine quad activation, lie flat on your back. One leg straight, one slightly bent. Flex the foot of the straight leg, toes toward the ceiling. Tighten your quad as hard as you can. Hold 5 seconds, release, repeat. This directly activates the VMO, the inner quad, the most important muscle for kneecap tracking. Glute bridge still on your back. Both knees bent, feet flat, hip width apart. Drive through your heels and squeeze your glutes as you lift your hips off the floor. Hold 2 seconds at the top. Lower slowly. Activates gluteus maximus and medius, the hip muscles that control knee alignment. 30 seconds. Move 0-3 standing calf raise. Stand behind a chair. Hold lightly for balance. Rise up onto your toes. Both feet. Hold 1 second at the top. Lower slowly. Strengthens the calf and improves ankle mobility simultaneously. Also helps popliteal muscles stabilize the knee on every step you take. 30 seconds. Move 0-4. Hip flexor stretch. Step 1 foot forward into a lunge. Back knee toward the ground. Use a cushion if needed. Push your hips gently forward and squeeze the glute of your back leg. You should feel a stretch in the front of the back hip. Releases the tight hip flexor, causing faulty knee tracking. 30 seconds each side. 4 moves, 2 minutes. Do this every morning and every evening. Consistency over intensity, every single time. Lifestyle and daily habits for knee health. Here are the lifestyle factors that either make your knees worse or dramatically better. These are non-negotiable. Row 1. Stop sitting for more than 45 minutes at a time. Set a timer. Get up. Walk for 2 minutes. Sitting compresses the knee joint and switches off your glutes. Every hour of unbroken sitting undoes the work you did in your morning routine. 2. Lose. Even 5 to 10 pounds if you're overweight. For every pound of body weight, your knee absorbs roughly 4 pounds of force when walking. Losing 10 pounds removes 40 pounds of pressure per step. That is enormous. 3. Wear supportive footwear. Flat, unsupportive shoes offer 0 shock absorption. You don't need to spend a fortune, but you do need a shoe with cushioning and arch support, especially first thing in the morning. 4. Anti-inflammatory nutrition. Processed foods, refined sugar, and seed oils drive systemic inflammation. Add omega-3 rich foods, salmon, walnuts, flaxseed. Add turmeric to your cooking. Stay well hydrated. Your cartilage is largely made of water. 05 cold and heat therapy. Used correctly. Ice for acute inflammation, new injury, post-exercise swelling. Heat for chronic stiffness, before the morning routine. Many people do the opposite and wonder why it doesn't help. When to see a doctor. I want to be responsible here. There are times when home management is not enough and you need to see someone in person. Seek medical attention. If your knee is significantly swollen, warm, or red, especially if sudden onset, you heard a pop during an injury, this can indicate a ligament tear. You cannot bear weight on your leg. Your knee locks up, and you can't fully straighten it. Possible meniscus tear. Your pain is getting progressively worse despite conservative treatment. You have fever along with knee pain. This could indicate infection. You've been dealing with knee pain for more than 3 months with no improvement. There's no medal for suffering in silence. If something doesn't feel right, get it checked. That's not weakness. That's wisdom. Advanced exercises for progression. For those of you who are ready to go further, here are the next level exercises to add once the 2-minute routine becomes easy. These build the foundational strength that keeps knee pain away permanently. Wall sit 30-60 seconds, builds quad endurance without joint loading. Step up mimics real life, strengthens glutes and quads together. Terminal knee extension with resistance band, the single best VMO activator in existence. Side-lying clamshell activates gluteus medius, fixes internal hip rotation pattern. Romanian deadlift best posterior chain exercise, hamstrings, glutes, lower back. Start with the 2-minute routine, master it, then add 1 exercise per week. Build a strong foundation. Your future self will thank you. Knee pain has a way of stealing your life quietly. It stops you from playing with your kids, from hiking that trail you've always wanted to, from getting through a grocery store without wincing. But here's what I need you to understand. This does not have to be your story. Your knees are not broken. They are asking for the right kind of attention. Strengthen the muscles around them. Release the tightness pulling them out of alignment. Move smarter, not less. Start with those 4 moves tonight, 2 minutes. That's all I'm asking. If this video helped you, please hit that like button. It helps this information reach more people who need it. Subscribe if you want more honest, no-fluff health content. Drop a comment below and tell me which type of knee pain you've been dealing with. I read every single comment. I'm Dr. Clarence Martin. Take care of those knees, because they're the only ones you've got. I'll see you in the next one.